guys, it is Janae with Daily Dental Hygiene, and today I'm going to be talking about working interview questions. People think that is just a dentist interviewing you. Absolutely not. I need to make sure that this is also a good fit for me because I'm going to spend my life here pretty much every single day. So I need to know that this is going to be the environment that I want to spend my energy at. So let's get into it. I want to say that a lot of the teachers when I graduated gave us a list of questions to ask during interviews, and I straight embarrassed myself. They put on the list things like, ask them, if your instruments break, will they replace them, and how often you're going to get new instruments. And I went in there looking stupid and demanding, and also no dentist is going to lie to you and be honest and say, hey, actually, we don't give our hygienists very good equipment, and we're not going to replace your instruments as frequently as you want. It's like, no one's going to be honest. You just have to figure that out yourself and get the vibe of the office. Everyone's going to be on good behavior during the interview anyway, but there are solidified questions and answers that you do actually need. Number one, is there a pay per hour or a day rate? Absolutely do not take a job if it is a pay per patient per hour. If you have a cancellation or a no-show, you are screwed. You are at work right now and you are not getting paid for it. You should get a base pay of say $400 a day, not we're going to pay you $50 per patient. No, it's not your fault if the patient no-shows or cancels or is sick or whatnot, but use that hour to restock your drawers, make goodie bags, get on the recall list. Help out the office. There's no reason why you can't find things to do at the office unless you actually just want to clock out and sit on your phone in the back. But if you are there, you should be paid for it. On top of it, is it commission-based or no? Some people do like to work commission-based. I personally don't like that. I like the security net of getting paid for the day. But I also have things that I do called commission plus base pay. So I get paid this much per hour, but every time I do a fluoride or a laser or whatnot, I also make a commission off of that. So are you only base pay for the day? Are you a base pay plus commission, or are you purely commission? On top of it, learn what your duties are. I can't even tell you, my first job, I played every single role in that office. I was doing billing, I was typing in codes, I was ringing up credit cards, and that was totally inappropriate. And when you go to your job, ask them, what are the duties of your dental hygienist here? So when they try to say, oh, Janae, can you start helping out at the front and start going over Delta Dental's treatment plans and start, no. That is not the duty of a dental hygienist. And I told you in the interview, these are the duties. You told me this, and this is what we agreed on. Otherwise, they are going to see that you can run yourself thin and just take advantage of you. And that's what happened to me, honestly. And then how many patients per hour? I showed up at an office once to temp, and they told me it was going to be 1 patient per hour, 8 patients. Every single patient ended up being a half-mouth SRP. Not cool at all. So check how many patients per hour, how many patients per the day. On top of it, how many SRPs? That is not fun to have 8 SRPs in a row. Your hands will not feel great. And it's really crappy to have back-to-back SRPs. A lot of offices will say, okay, we'll do an SRP in the morning and then we'll do, an SRP deep cleaning in the afternoon, or we'll give you a couple breaks in between each patient. That's how it should be. On top of it, do you get help? Do you have an office where there is 1 dental assistant? If so, you should probably run, because if there's 1 dental assistant, they're helping the dentist the whole time doing preps, crowns, fillings. That means you're going to do all the sterilization. You're going to get no help with x-rays, no help with checking out. If you're running behind, well, chug an energy drink because you're screwed. You got to get out there. If you run behind, there's no team support. And that's really crappy. Oh my God, I'm running out of Cavitron tips. And if I don't do all the sterilization right now, I'm not going to have clean instruments. No goodie bags, no preset trays. So you should definitely, make sure that you're going to get some help. And how long do you get for a new patient? I have shown up and they give me 1 hour to do a FMX, full mouth probing, exam, and the cleaning. That sucks. That is a crappy 20-minute cleaning. So make sure you know how much time you're going to get per patient. Also, How much time are you going to get for your deep cleanings? And how do they do the deep cleanings? Some places will give you 2 hours to do the full mouth. Some people will say do a debridement first and then a half mouth. Some offices say you start with the half mouth, no debridement, and then the next appointment's a half mouth. Also, a patient comes in, I haven't seen them in 3 years. I probe, I look at their x-rays. They're no longer a prophy. They need to be scaling and root planing. They need to be a deep cleaning. Do I bring them back? You need to figure this out, because it is not cool and not fun to show up and you get a new patient and you get an hour. Like, you should have enough time to do a deep cleaning. You should get a minimum of an hour to do a half mouth. And that is if all the x-rays and probes are done. Like, you should not have 45 minutes to do the FMX and the probes and then start their half mouth. So find out how much time you are allotted for some of these procedures, because it's important for your hands, your ergonomics. It's important for patient care, and it's not fair to the patient that you're rushing and getting 1 hour to do a Hail Mary job. If you need to bring them back, you should bring them back, because that's the proper procedure. I mean, if I get a new patient and they end up being a prophy, sure. But if I'm running late and there's not enough time to start that deep cleaning, I'm either going to reschedule them or just do the debridement and then bring them back for a half mouth. But you need to decide what you are comfortable with, how fast you're able to work. And also, if you're getting help, it depends on the team player personality and attitude of the office as well. Find out what you're comfortable with. But at the end of the day, make sure that you are asking the interview questions as well, and you're not just getting screwed. It's important to know, because if you don't ask these questions, you're going to have your time and your money screwed with. And those are two things that I do not allow in my life. Money and time to be messed with. So please use these interview questions so that you're not 2 months in realizing that you have made a terrible decision and you are totally burnt out, or you are not getting paid appropriately, or you are being overworked like a freaking mule. But besides that, guys, good luck with your interviews. Don't make all the mistakes that I've made. I have been your guinea pig from day one, and I want you guys to be in way better offices than the offices I started out in. So take care, find your unicorn office, and keep watching Daily Dental Hygiene.